All right, good afternoon everyone. Okay, so we'll do health first and then we'll do other matters. So good afternoon Queensland, and hello to all of our Facebook Live followers, and welcome back Lane. Okay, so today we've had 7,462 new cases, so the numbers are coming down, and that's 2,849 positive rats. Tragically, we have to report 3 people have lost their lives today, and the Chief Health Officer will give some more details. And once again, we express our condolences to the families. It's heartening to think, though, that the numbers initially are coming down, so fingers crossed. We've also got the Chief Health Officer will go through the numbers in the hospitals as well. We've done 15,586 tests in the last 24 hours, and in terms of vaccine coverage, 91.98% have had at least one dose, so that's good. Nearly 92% of Queenslanders have had their first dose, and we're at 89.53% fully vaccinated. 1.4 million Queenslanders have received their boosters, that's 55.17% of the eligible population. And of our 5 to 11-year-olds, we're at 33.37%. And once again, can I please urge parents to think about booking their children in to get vaccinated. Look, I'm happy to advise my whole family has been vaccinated. My parents, my sisters, my nieces, my nephew. Honestly, and I know there's millions of families out there that have done exactly the same thing. But if you are unvaccinated, you run the risk of ending up in hospital and becoming extremely sick. And you all would have heard from Minister Grace the other day. She said this is a virus you don't want to get. So please think about, if you are not vaccinated, to come forward and get vaccinated. So I'll hand over to the Chief Health Officer and then to the Health Minister, and then we'll do other matters. Thanks. Thank you.
Thank you very much, Premier. Sadly, we have 3 deaths to report today. 1 person in their 60s, 1 in their 80s, and 1 in their 90s. Of these 3, 2 had 2 doses of vaccine, and 1 had in fact had 3 doses of vaccine. I probably wouldn't read too much into a single day of reduced data. I think we need to look more for a trend in terms of what is happening with deaths. But our thoughts are very much with their families. In terms of the health system, we have 744 people in hospital being treated for COVID-19. That includes 46 patients in hospital in intensive care. That's not much of a change from yesterday, but I think I've previously mentioned Sundays tend to be slow discharge days in hospitals, so it's not often on a Monday we don't see a great reduction in patient numbers. But what I would say is that over the last 7 days, say last Monday, the 24th of January, there were 878 patients in public hospitals in Queensland, and that's fallen to 744 today, which is a 15% decrease. Most of that reduction has been in a relatively small number of areas. That's the Gold Coast, Logan, Ipswich and Cairns. We're expecting that the numbers will start to turn in the rest of southeast Queensland and elsewhere in Queensland in the next 7 days. Thank you very much. I'll now hand over to the Minister.
Thank you, and my condolence also to the families of the 3 individuals who have passed away in the last 24 hours, and remind people of the importance of getting vaccinated. We are seeing a slowing down of our 5 to 11-year-olds. We really want families to take the opportunity of this next week, before school goes back, to go to one of the many vaccination centres or pharmacies or GPs that can provide not just vaccinations for 5 to 11-year-olds, but also our 12 to 15-year-olds. Our 12 to 15-year-olds, we're still sitting at 67.29% double dose. So it is quite a low number, and these teenagers will all be going back to high school next week, and we would love to see that vaccination number come up. And of course, with the 5 to 11-year-olds, we've had 33.37% now. We've got about 65 schools that are now participating in our Vax schools for the next 7 days. So have a look at our website. You'll be able to find those sites that are open during the week, and also this coming weekend. We want as many people to come forward and get vaccinated. And I also want to just give another shout out to our First Nations people, especially in our more remote communities in the far north, to come forward and get vaccinated. It is not too late to do so and to start their journey of vaccinations. And if you're eligible for your booster, and all those young people who went and got vaccinated in October and November, just as our mandatory vaccination was coming in for our pubs and clubs and hotels and all of those, I remind those teenagers that they will be coming up to their 3-month mark for their boosters shortly. To have a look at their immunisation record on their phone to see when it was, and if it was 3 months ago, you can come forward and get your booster. And really positive news that we are seeing even a further decline in the number of staff that are isolating and quarantining. So I think yesterday I said we had over 3,400, we're now down to 3,049. So that's a positive sign, but we've got a way to go. So please everyone, keep following the rules, wearing your mask, social distancing, good hygiene, and of course come out and get vaccinated.
There's some teachers who express concern or fear that those below vax rates, especially 12 to 15, see a spread in the school community. Is that justified, that fear?
Look, as the Chief Health Officer has said, the children themselves are not likely to get seriously unwell, but they are likely to transmit it. That's why we brought in the mandatory vaccination for our teachers and for our school staff, for this very reason. We know the difference the vaccinations make, and having our school staff, including our teachers, vaccinated will make all the difference in reducing that transmission. And as these numbers come up of the number of kids who have been vaccinated as well, will help reduce that transmission.
Dr. Gerard mentioned the drop in hospitalisations in the last week, but we've had complaints from people who are having to go into private hospitals for key surgery for breast cancer and having their surgery delayed. How much longer might we rely on those public health facilities, private health facilities?
Look, I don't think any of us can give a definitive time frame on that. It's a day by day, week by week proposition. We are not through the wave as far as across the state. We're still seeing some higher numbers in the north, and we want to make sure that we're through that wave before we look at pulling back any of those beds that we've secured in the private hospital sector. And as we said, we have suspended elective surgery until the start of March. I said we'd review that at the end of January. There will be no change to that suspension at this time. So we will still suspend that elective surgery until the start of March.
If a student tests positive, are other parents going to know, and will they be alerted with the back to school plan?
Yes, so the public health unit will work with each individual school where there is an outbreak. So again, it'll depend on whether that child was unwell at the school, and the public health unit will still do the normal contact tracing to define, who needs to go into quarantine as a close contact. So it won't be an absolute. It's not that every school would close down or whole classrooms need to quarantine. They'll look at the individual circumstances around who is infected and whether how many people might need to quarantine or at least get tested before they return to the workplace or to the school.